My name is Nora Laskowski. I'm a physical therapist at Olmsted Medical Center. Some of the specialties I see in physical therapy include orthopedic injuries, so whether it's after a surgery or just after a general injury, I see a variety of patients after that. I do see individuals with neurological conditions, such as after a stroke or if they have MS or just balance problems. And then I also see pediatric populations. So I see kiddos as young as 2 months and then on from there, depending on what their needs are, and go from there. I became a physical therapist because I wanted to learn more about how to help my body in terms of taking care of it, and then at the same time teach others to do that, because movement and health is very important and you only get one body, so we have to make sure that we take care of it. I want patients to know when they come into a physical therapy evaluation or any appointment they have is that we aren't looking for, to chastise them if they don't do their exercises or to hide, certain things from us. We want them to be as honest as possible because that helps us do our job, and our general goal is to have a teamwork of, their information tells me what exercises and interventions I may need to do, but then I also want them to feel like they have input in their care as well, because if they feel like they're not active in their own care, it's hard to kind of get to the core of what's going on. Making a connection with patients is critical, because if you don't trust someone or make that connection, it's hard to tell them about, how has your pain been, or, what you've noticed can be tough, because there are certain situations where you need to have that connection. And I find it much easier to talk to someone when I feel close to them. And, if you don't have that, it's kind of tough to be able to divulge in some of those topics for sure. My hobbies outside of work include being with friends and family, being with my dog. I have interests in music, video and board games, and hiking, and I also enjoy weightlifting. I enjoy going to work at Olmsted Medical Center because we have such a community feel just in general. You can tell when you come into the building, staff cares for each other, we care for our patients. We want to listen to them and help them as best as we can.